I'm Dr. Levitt with Levitt Medical Aesthetics. Today we're going to be talking about our most popular treatment, which is injectables. That includes neurotoxins and fillers. Neuromodulators and fillers sound similar, but they're actually very different. So neuromodulators like Botox, we use to paralyze muscle and stop wrinkles. So basically every time you raise your forehead or frown or smile, you get lines, and as you do that over the years, that turns into wrinkles. There are 3 FDA-approved areas that we use for Botox. So it's the 11s, which is right in here, the forehead or the frontalis, and then the crow's feet that you get when you smile. Fillers, on the other hand, are used like they sound to fill areas up. So we commonly do that in the cheeks, under the eyes, nasolabial, and marionette lines. With the neuromodulators like Botox, we typically treat about every 3 to 4 months. After that, you're going to start to see the lines coming back. So the best way to tell, we normally tell people once you start to see the lines, not once they're bad, but as soon as you start to see them, you want to come back in for your next appointment. With fillers, it really varies by the area we're treating. So lips, I normally tell people about 6 to 12 months. And some of that depends on how big you fill them to start. With areas like cheeks, it can last up to 1.5 years to 2 years. Botox typically has no downtime. However, anytime you're stuck with the needle, it's possible to get a bruise. With Botox, it's a really tiny needle, so if you get a bruise, it's very small and it goes away in about a week or so. But in general, I'd say there's no downtime for Botox. But if you have an event coming up, you probably want to get it done at least 2 weeks in advance so we can see the results for your event. With fillers, the downtime is typically you're going to get some swelling, especially in the lips, and expect bruising. You may not get it, but just expect to get some. Swelling is usually gone in a few days, and bruising is like any typical bruise, about a week or so. If you have something coming up, I'd say get it done at least a week or 2 in advance to get really the best results and make sure all the downtime is gone. Some common questions we get or misconceptions we get about Botox is people asking if it's too early when they're in their 20s or 30s, for example, to get Botox. And really that's the ideal time to get Botox. So as you make expressions, you make wrinkles. So if you don't have any wrinkles, if we give you Botox, you will never get wrinkles. So really the earlier you start, the better it is, because it's much easier to prevent wrinkles than it is to get rid of them once they're there. So as far as how much Botox we do, people often comment that they don't want to look frozen or plastic. And in general, you should not look frozen or plastic unless it's been overdone. Most of our clients want to look natural, and that's what we try to do. So it's always a balance. We do want to stop the muscles from moving because we don't want to be making lines, which is how you avoid wrinkles. And that's the whole point of Botox in the first place. However, as long as it's done properly without overdosing, nobody should notice. So one of the biggest differences between us and almost any other practice is that here I actually do all the injectables myself. So you're always going to be getting your injectables done by a board-certified physician. So the best filler for you really depends on your goals and what you want to treat. So for cheeks, we have certain fillers we like to use. For lips, we have certain fillers. But to really get the best information on that, it's best to come in for a consult and we can talk about your goals and what kind of look you're going for, whether you want something more natural or something a little more obvious. And we can discuss what the best one would be for you.